Now we will pass that graft inside. Yeah, that is the animation I showed. This is the graft which is being used in this country for the first time. It's called the Thoraflex graft. Made by a company called Terumo from Japan. Now this goes into the lower part where you saw the tear in the aorta, and it will fix that. Now all of these are branches of graft which you have to connect to the blood vessels going into the upper half of the body, to the brain and the upper limbs. This is being stitched to control the bleeding. You can see blood leaking through that. Now the circulation to the lower part we have restarted. Normally we take about nearly 30 to 40 minutes to do this procedure. And during that time, there is no blood flow in the lower part of the body. But once we cool the blood, all the organs like kidney, liver, intestine, stomach, everything will be protected. So now we are starting the blood flow through this graft. That is why the blood is leaking. So we have to stop all the bleeding there. And you can see it's all dry. As you take more stitches, because even a small needle hole sometimes can leak. The tissues are so friable. And we are starting circulation through this tube to the lower part. That's what you are seeing. Connecting the tube. To restart the blood flow. The blood is coming back once you. That is from the heart-lung machine. We are shaking the patient to get the air out from the graft so that air will not go to the brain. Now lower body circulation is maintained from the pump through this tube, and we are connecting the blood vessels to the upper limb and the brain while the suturing is going on. And release the clamp, blood will flow through that. And the needle is poked to remove air. After that, we connect this on to the heart, because the heart is not getting any blood. Now once the tube is connected, the heart will start beating. It stitches in the upper part of the graft onto the lower part of the aorta. After this, we slowly warm the blood. Temperature which is 24 degrees now slowly will come up. You can see the heart start beating once warm blood goes into the heart. And now one by one we connect the blood vessel going to the brain. And at the end of the procedure, we disconnect the patient from the heart-lung machine. This is the last anastomosis we call. Disconnection of this graft to the blood vessel going to the right side of the brain. The left side is already connected now. This blood vessel supplies blood to this. That is the end of the operation. You can see it's all dry. They finished the surgery, disconnected the patient from the heart-lung machine. That's a completed operation. Now that is the before operation. This is just taken about just 2 weeks after the operation. The operation was done exactly 3 weeks ago. Patient was discharged a week ago, and before discharge we did this. After discharge we did this picture. You can see the tear in this all areas are covered with this, and the lower part of the aorta is absolutely normal. There is a small thing here that is nothing to worry. That is normal. It will heal by itself. So as I mentioned, it is so important to have a team. When a patient comes, first of all, sometimes these cases can be diagnosed as heart attack sometimes. I have had patients who have been treated as a heart attack, and then maybe after a day, some patients come. About 50% of the patients will die in 24 hours if not diagnosed and treated on time. So, once you come, see, today if a patient comes in the chest pain, the first investigation we do is a aortogram. So, and then we have our diagnostic radiologist, and we share the pictures, discuss among ourselves, and planning is also very important. Availability of hardware, that is the graphs, all those things are available here because we do the maximum number of these cases. The companies keep all these things in our hospital. So any time of the day, even if the patient comes at midnight, 12 o'clock comes, 1 o'clock patient will be on the operating table. I can organize all our staff, thanks to Dr. Raju, who gives us all the facilities. So nurses will be available, the heart lung machine technician, the perfusionist, anesthesia technician, anesthetist, the assistants, and all the people are available. Nurses, within half an hour we do that. We don't wait because there are instances where patients coming in the casualty, then we are not able to arrange blood. Sometimes without blood we cannot do the operation because we need large amount of blood. It's a particular group of blood. Once long ago I remember while arranging blood, the patient died in the emergency. So nowadays we straight away take the patient. As soon as come, we do the patient goes to the CT from the emergency. From the CT room, patient comes to the cardiothoracic ICU and then straight to the theatre, irrespective of whatever be the thing. Because once about 2 weeks ago, a month ago, we had a patient. As I left to the hospital at 6 o'clock, my assistants were fortunately there. Doctor's mother came with a dissecting aneurysm with a leak, and then they resuscitated the patient and put the patient on heart lung machine. By the time I came from my home, my colleagues have already put the patient on heart lung machine. We operated a 73-year-old lady. She is still alive. Went home after 15 days. So it is important to have very important to have a team and infrastructure and an experienced people to handle this. Plus, people, the awareness among the people that it is. Because always, even doctors who have not seen this problem and has not got involved in the management and the results of this procedure, still feels aortic aneurysm is a very, very bad disease. But I can tell you from my experience of doing a few thousand cases that if operate on time with a good team and good facilities, the success rate now is more than 95%, which is comparable to any best centers in the Western Hemisphere. So we have come to that level, and our people are, should be aware that such treatment is available, because to have this treatment anywhere, it is beyond the scope of anybody in this country, any common man, because it is so difficult. So that is our team. Thank you for your patient listening, and if you have any questions, I will be very glad to answer.